is Colleen Hendon. I am a program manager at Ohio State University's College of Public Health, and I'm also a mental health first aid instructor. So mental health first aid, we provide a virtual or an in-person kind of experience for folks to be able to learn the basic kind of signs and symptoms of some of the most common mental health challenges in the United States, as well as substance use disorders. So they're introduced to some of those early signs and symptoms, and then we really walk through kind of a 5-step action plan. So the acronym is ALGEE, not like algae that you might find in the water, but the ALGEE, and assess for risk of suicide or harm is the first step. Then we have our L, which is listening non-judgmentally, and I oftentimes like to say it's the easiest step to remember, but oftentimes the most difficult to put into practice. Then we have our G, so giving reassurance and information. So we talk to folks, what does that look like versus advice. So oftentimes when we're trying to help somebody, we try to put our helper hat on and we try to fix things and provide that oftentimes unsolicited advice, which oftentimes we don't enjoy receiving. So being able to provide information, maybe about a specific mental health challenge, or maybe about a resource, or just some helpful information, and then providing hope as well is really important. And then we have our 2 E's. So we're encouraging 2 things. So we're encouraging that appropriate professional help, and then we also go over our last E, which again, we kind of talk about last, but I think it's one of the most important pieces, that encouraging self-help and other support strategy. So mental health first aid, I think, is really helpful in not only educating folks and helping to destigmatize mental health and really paralleling mental health with physical health, but it also has a piece of the self-care. So also making sure that, while we're kind of keeping an eye out for other folks and those signs and symptoms, we also need to make sure that we're taking care of our own mental health as well.